Okay, guys, well, we are just going to go ahead and get started. Again, my name is Danny Walker, and I am just honored to be able to be here and really host this webinar. I'm not going to say much tonight because Dr. Falk has a lot more to say than I do, but I wanted to introduce him. We also have his wife, Christy Falk, on the line here, and her and I were able to do our first webinar about a month ago. She shared some amazing information about how she's been able to fight sarcoidosis and overcome the majority of symptoms that sarcoidosis brings. And I know she just shared some excellent news and an awesome x-ray where her lungs look pretty darn clear to me, and has had just a miraculous recovery, and from her own learning and her own desire to stay healthy and live without the limits of disease. But also with the help of her husband, who is a chiropractor, Dr. Daniel Falk. He is also the, let me see here, sorry, I just lost here we go. He's the president and the board of directors for the Wellness Council of South Carolina. As a chiropractor, he has his own practice. He's also sits on several other boards, but is the sports chiropractic for triathletes. He's called the Iron Doc, and he goes to Ironman competitions in Hawaii and treats the Ironman competitors there. He is a chiropractor physician for the Carolina Spartans, which is a professional women's football team. I'm super curious about that. I didn't even know they had such a thing. And he sits as the president of the South Carolina Chiropractic Association. So he's going to speak tonight, help us all improve our breathing, and share some techniques and tools and tips so that we can live a better quality of life and hopefully relieve some of the pain and the symptoms that you might be dealing with, whether it's from sarcoidosis or any other diseases. So Dr. Daniel Falk, are you on the line with us?
Yes, sure am. How are you doing there?
Excellent.
Hi, everybody.
We are all doing really well, and we're just thrilled to have you here. And before you get started, just for all the listeners and everybody here, if there's a question that comes up or something that you really would like to ask, a pressing question, feel free to ask it. But if we could wait until the end of the presentation, it makes it a lot easier for us to keep track and do a better job of making sure we address questions. And of course, this webinar is for educational purposes only, okay? We're not here to diagnose or treat. This is for you to take this information, be better educated, and decide what you want to do with it. But our hope is that you find it valuable and that it does in some way, shape, or form. You implement maybe something you learned tonight and it improves the quality of your life. So Dr. Falk, go for it.
Okay, thanks, Danny. I said, my name is Dr. Daniel Falk. I have a bachelor's in biology, I have a bachelor's in anatomy, and my doctorate in chiropractic as well. From a pretty prominent school, I think the school I went to, Parker College in Dallas, Texas, gave me a fantastic education, and they really taught us to not only just to look at the person as a disease, but look at a person as a whole and evaluate that person. And you can see, we also had a class that always struck me as interesting. Is called Differential Diagnosis, and I don't see that a lot in the medical world. If there's any medical doctors out there, I'm not going to harp on you or anything, but a lot of times you'll come in with a problem, like the previous slide, you have trouble breathing, and they might think asthma or something like that, and they'll try to diagnose you with something or try to pin all of their evaluations to find what they think it is at first. But differential diagnosis means you got to find a lot of different things and try to figure out which one it is. And don't rule anything out until you know exactly what it is. So my wife, Christy, had a lot of trouble breathing. We took an x-ray and saw her lungs modeled with all this stuff, and I didn't know what it really was. I work with some of the radiologists in the hospital system here, and I just go to them when I see something I don't understand. And I brought it in, and the radiologist said there are several things that it could be. And we opened some books and nailed it down to sarcoidosis. And then she had some lesions. We had a doctor do a biopsy and actually figure out and confirm that that's exactly what it was there. Okay, so we actually went to Cleveland Clinic, or she went to Cleveland Clinic, to the #1 sarcoidosis medical doctor in the country. And we had, I don't know, 2 years worth of x-rays showing her lungs progressively getting worse. And so she brought those with her, and they did all kinds of tests. I think they racked up $8,000 worth of diagnostic tests. They told her that she will get worse, maybe a lung transplant. They said you can just start prednisone immediately. They talked about oxygen. The same thing that they would have said in any kind of a breathing disorder that she could have had anyway. So when she came back, and she was pretty distraught because they said, don't even think about trying to have children. And that was kind of our plans. That's why we're trying to get help to rule that out. So I called him up because I couldn't go to the trip. And I said, well, what causes sarcoidosis? You're the expert in the country. You're the #1 doctor in the country for sarcoidosis. This is your field. And he said, I don't know. And I said, you don't know what causes this, and you're the expert, and you're going to treat it with the same thing you would treat any kind of lung disorder. So that kind of put a real bad taste in our mouth. And Christy is diabetic, so steroids are kind of out of the question because it really messes up her blood sugar. So we had no choice but to seek some alternative means, as well as do some things that we could do as well. So so I try to be thorough, and I research everything. So when Christy, I knew about diabetes, so we learned everything we could about that, and she keeps her diabetes under control. And I know you guys know about it. The type 1 or type 2, you get an A1C to see what your 3-month thing of diabetes is and what your blood sugar is at. And hers has been, what, 5.3, 5.5. I mean, anything under 7 is good for anyone diabetic, but in the 6s and 5s is almost unheard of because people know how to really manage it well. So Christy can manage all that pretty good. So anyway, so we're determined to get her well no matter what. So let's go to the next slide here. Everybody.
Can everybody hear okay?
He said he can hear. All right, so just talk about chiropractic in general. Like I said, it's more than just people think just cracking bones, but chiropractic is alternative health care, and we are billed kind of as a primary care physician, which means you can go to a chiropractor off the street without any kind of referral, and that means the chiropractor is responsible for any disease process that you may have. So our training and diagnosis and exams are pretty thorough, I believe, at least in my school, and I always really tried to learn everything I could about it, because I said if someone comes in my office, I want to know if I can help that person or I need to refer them out there. Chiropractic has survived the onslaught of some medical distraught of trying to get rid of alternative care practitioners, and you don't see that many schools, but there's still a lot of chiropractic schools, and chiropractic even survived the AMA trying to slander them and won a lawsuit in '75 to survive there. So anyway, so chiropractic deals with not just the bones and the joints, but also the nervous system and how that affects every part of the body, right? Your nervous system is your master system. So without that, you're really nothing but a blob of flesh. So our nervous system contains our mind and our soul, and that helps control everything in our body. So a lot of times we'll see problems where there's pressure on nerves, whether from a vertebra, from a nerve, from a muscle, from any kind of adhesion, and that can affect how everything functions. Okay? And so I assume that most people online here have some breathing problems or dealing with sarcoidosis or something like sarcoidosis, and it has other lesions, but the lungs is what we've seen the most problems with. And so we want to give you the best chance of being able to breathe. Even if you have adhesions or granulomas in your lungs, you still need to have the best chance of breathing. So let's go over a little bit of anatomy of the body. Go to the next slide, Ms. Dan. And we're talking about the anatomy of our thoracic spine and our thoracic body and our neck as well, because all this is connected. Okay, and all these muscles that you see here is help you breathe as well. And you know, the main muscle to help you breathe is the diaphragm. That's not shown here, but a lot of people that don't breathe with their diaphragm, they call it belly breathing, and that's really how we're supposed to breathe. When you belly breathe, your rib cage also moves, and when your rib cage moves, then your rib cage expands, your lungs expand. All these muscles are kind of involved with that. Okay, so we're going to kind of go over those. So we go to the next slide. All right, and when you're in trouble breathing, have you had pain in your back or pain in your rib cage, pain in the front? Okay, you see these ribs. Sometimes they'll say I have a pain in the back, and it goes all the way to the front of my chest. Okay, a lot of times that's one rib. One rib's affected, and under each one of these ribs that you see here, there's a nerve, and it runs under in a little groove under each rib. Okay, so if the rib is not moving properly, or there's adhesions, or there's problems in the muscles, then you can have pain all along that rib. Okay, and we can see vertebra rotated, and the ribs can rotate and twist like in scoliosis. And when that happens, that can actually have the whole bone kind of twisted. And when we address the ribs as chiropractors, people say, well, the ribs move. Let's go next slide. And then you can have pain in the front and the back. But yeah, of course, ribs definitely move. So the first 10 ribs are attached to the spine in the front and go to the sternum in the back. And then the last 2 ribs you call floating ribs. And those ribs can cause a lot of problems. If you had pain just above your lower spine, above your lumbar spine, those can cause some problems because those can twist, and they're hovering and floating, and they can twist and get out of place and cause some pretty severe problems on the very bottom of your lungs and your rib cage. Those are painful. And the other ribs, though, you see they actually have bones in the front, and then halfway through they join cartilage and then join the sternum through cartilage. And then the upper ribs actually go all around and touch the sternum also. So you can see how the vertebra goes up the spine, and these ribs here, I don't know if you see them, but there's joints at the vertebra, and then at the sternum is at the rib, and the joint right there. So each joint, each connection where the ribs join the spine and join the sternum can cause a lot of pain if they're not lined up properly. Okay. And then as we breathe, the whole rib cage should move. Each rib moves individually and together as one big unit, and that's kind of how we breathe. Okay, so 1 or 2 ribs, a lot of ribs out of place can cause a lot of problems. And a lot of people are breathing only with their accessory muscles. So if you breathe shallow, you're usually breathing with the very muscle at the very top of your rib cage, and that's not how you're supposed to breathe. Okay, let's go to the next one. Danny, next slide. Okay. Okay, so let's talk about inspiration and expiration and how these ribs move. Now, obviously, if you're belly breathing, your diaphragm on the left will contract, and then it actually pulls down and then pulls air, makes a negative pressure into your lungs, and that pulls air into your lungs in there. But when that happens, air goes into the lungs and your lungs expand, and then your ribs actually should move and expand with it. Okay, and you can see there's little muscles in between the ribs, or intercostal muscles, and there's outer and inner intercostal muscles. So the outer or external intercostal muscles, they help the rib cage move when you're trying to take a deep breath and really expand your rib cage, and they help the rib cage kind of lift up. And it's kind of funny how it works. When it lifts up, the back of the rib actually kind of moves down, and the front of the rib moves up. And then I find when people have rib dysfunctions and they can't breathe too well, then I'm adjusting the ribs in the back. They have to go down to adjust them, and then the ribs in the front have to go up. And you can see how they attach to cartilage. That blue stuff in the front is cartilage in the front. And sometimes you can have an injury or something where the rib doesn't line up with that cartilage, and it can almost detach. And that can hurt just as bad as having a fracture in your ribs. And if you had a fractured rib, it's kind of unrelenting pain. And that takes a while to heal. But if you have this rib separation where the rib actually pulls away from the cartilage, you can have a lot of pain right there. A doctor knows what they're doing, can set that back together properly, and they line up. As soon as they line up, you can feel almost an instant kind of relief. So it makes a big difference there. So we want these ribs to move. Now, if some of these ribs aren't moving and you're trying to expand your lungs and your rib cage, and those ribs aren't moving, they don't let it expand, you can see there'd be a lot more trouble breathing and taking a deep breath in. Now, if you have granulomas in your lungs already, and then you can't expand your rib cage, then that makes breathing a whole lot harder. Okay, so it makes sense that we want all these joints to function and move as much as they can. So if you have problems breathing or problems granulomas in your lungs, the more your lungs can move and the more your rib cage can expand, the better that you can breathe, and the more actually lung volume you'll be able to use even with a problem like that. Let's go to expiration, Danny. Okay. And expiration is kind of the opposite. Okay, so your diaphragm relaxes and then you're breathing out, but you have these extra muscles that you can use to breathe out, and they are the internal part of those muscles, or the inner part of those muscles in between the ribs, intercostal internal muscles there. And then when you're forcing a breath out, you're really trying to breathe out, those muscles contract and pull your rib cage down and together. You also use your abs for that too. So if anyone's doing core exercises and you always want to pull your belly button in, you see that middle arrow right to the belly button down there. You're breathing out and you pull your belly button in. It actually helps you get all the air out of your lungs in there. So if you guys have talked about breathing exercises, you can want to incorporate all these muscles and get your lungs to expand about as much as you can there. So if you want to take a deep breath in, best number one is posture. So getting your shoulders back, okay, getting your shoulders and your muscles and your scapula kind of out of the way. And we take a deep breath in, you breathe in through your belly, and you feel your whole rib cage expand. Okay, so every time I take a deep breath like that, you take a deep breath in, your whole rib cage expand. You feel it expand from the bottom ribs all the way up to the top ribs. If you're trying to breathe and all you feel is just the very top of your rib cage moving, then you're a shallow breather probably, and you're not using the full capacity of your lungs, whether you have granulomas or not there. Okay, so good posture. When you're sitting up straight, getting your shoulders back, opens up your rib cage a lot more, and then lets you take a much deeper breath there. And you really want to practice breathing from your belly and to feel your ribs expand and open up, because that's so important on getting the best breath that you can. I teach my patients to do kind of relaxation technique and trying to get as much oxygen as you can. You want to breathe in slowly and a 5-second count. So you're breathing in for 1, 2, 3, 4, 5. Hold your breath for about 3 seconds, and then slowly breathe out for 8 count. 1, 2, 3, 4, 5, 6, 7, 8. Okay. You do it all together. Ready? Take a deep breath in for 5 count. 1, 2, 3, 4, 5, and hold it. 3, 2, 1. Everybody breathe out for 1, 2, 3, 4, 5, 6, 7, 8. Okay. When you're breathing out, a lot of times you have residual air capacity in your lungs, and we never get rid of that air. Okay? Sometimes it's important to really work your lungs and make sure they compress as much as they possibly could. Yeah, it definitely feels pretty good. Okay, so those are exercises that I recommend, and everything in your body is dynamic, which means it can get better. It needs to move, and movement is dynamic. So if you're moving, then you're actually helping improve things, improve function. Okay, so even if you have trouble breathing, doing these exercises will increase your lung volume. You got to make sure that your ribs are working and your muscles are working properly there. But that's one of the best exercises I recommend. Posture is huge. If you're hunched forward right now at the computer, like I am trying to talk to you, your shoulders are forward and you're compressing down, then you're actually decreasing your lung volume. Okay. All right. So I think we have
So Dr. Falk, sorry to interrupt, but I just wanted to ask a question. Since we have people, on the line here who are going to want to do this breathing technique, how many times, how would you have me sit, with my feet flat on the ground, or what's the best position to get the best posture for this?
Yeah, you want to sit back straight. You want to have your feet down. Don't cross your legs or anything. And pretend someone has a string on your head holding you up, and then get your shoulders all the way back so your shoulder blades are almost touching. And then you practice that. You start with your stomach and you feel it breathe in, and all your ribs kind of work with it. Now, if you have pain in certain areas of your rib cage and your back, your front, you probably have a problem that needs to be addressed by a doctor that knows how to fix that there. But I would recommend 5 to 10 breaths at a time. If you're really stressed, this is a great technique to reduce stress, because when you're breathing in for that 5 count, think of all the stress in your body. Think of all the stress in your shoulders, in your neck, and in your back, and in your chest. And think of all that stress, any problems you might have. And when you're holding it for 3 seconds, concentrate on that stress. When you breathe out through your mouth like you're blowing out a candle. And think of that stress kind of leaving your body when you're breathing out. Thinking your shoulders dropping, your muscles relaxing. And if you do 10 deep breaths, thinking that breathing in, think your stress leaving your breath when you're breathing out. That just relaxes you. That's a great way to go to sleep too. A lot of my patients that have trouble sleeping, I'll say do 10 to 20 breaths like that while you're going to sleep. Think nothing about your breath, and just your breath and all your stress leaving your body. And most people can't even make it to 20 breaths before they fall asleep, and they get a really restful sleep because you're pretty much training your brain and your body to breathe while you're sleeping. And people that don't breathe well, or they hold their breath a lot when they're sleeping, practicing just that technique can make a huge difference. And you need to sleep to heal too, so you need to breathe for that as well. So I'd say 5 to 10 during the day, and then if you're going to sleep, see if you can make it to 20 breaths, just like that, really deep. Let's go to the next page.
Thank you.
What's the next slide we got? Okay. This is a typical chiropractic slide, I think. Pretty much, like I said, chiropractors are nerve doctors, and what our job is to remove pressure and dysfunction on the nerves in there. Okay, and so with all these vertebrae, there's 24 different vertebrae in the spine, and then each pair of those vertebrae have pairs of nerves on each side that go out to different parts of the body. Okay, and you can see that the neck vertebra control the nerves that go either up into the head and the face, and also down into your arms. But at the base of your neck, and then the very top of your thoracic spine, your mid back, you can see those nerves right in the middle. They go to your lungs and your heart. Okay, so you need those nerves free so your brain can control your lungs and your heart properly. I want to talk about your heart first, because think of it as kind of a link. Your brain doesn't just control it, but it also needs that feedback to know what's going on with your lungs and your heart. So if there's pressure on those nerves, those organs aren't going to function properly. Just like if you had pressure on your nerves going down your arm. You know, you've ever had problems in your neck and there's pressure on those nerves, you can have numbness or tingling down your arms, okay? Because your brain only gets part of a signal back and it can't interpret part of a signal, so it feels like pins and needles or numbness or tingling, that weird, like your hand went to sleep kind of thing. And if there's a lot of pressure on the nerve, your hand can go completely numb. Okay, so that same thing can happen to organs as well. So if nerve function isn't going to the organs, then the brain can't control it. You know, your brain actually controls your heart. Your heart has a normal rhythm of 100 beats per minute. That's your normal rhythm of your heart. Okay, and you always hear when someone's sitting down, their resting heart rate should be 60 or 70 beats a minute. Okay, so your brain controls that, says you know you're sitting down, you know you're not moving, so the brain slows the heart rate down to 60 or 70 beats a minute. Now, somehow we can have what we call an escape. Maybe the heart might start beating too fast for no reason. 100 beats a minute, and then a signal goes back up to the brain from the heart and that nerve, your vertebra to the brain. The brain gets the signal, says, whoa, this heart's beating too fast. A signal back down and slows it down to where it needs to be. Now, these vertebrae can get misaligned. You can have adhesions and pressure on that nerve, and let's say the signal goes from the heart to the brain, saying it's beating too fast, but that signal gets blocked at the vertebra level and never makes it to the brain. And then the brain doesn't know there's a problem. You can go to your doctor and say, hey, your heart's beating too fast, and you're a hypertension, so you need to go on these blood pressure pills forever. Okay, now I'm not saying don't rule out heart disease. You want to get your heart checked out, make sure it's functioning properly. But if there's pressure on the nerve that controls that function, a lot of times I've seen, especially in younger people, getting pressure off of that nerve can restore normal heart function without the need for medication like that. Okay, the opposite can happen too. Let's say the heart starts beating too fast, and the signal goes up to the brain, and then the brain sends a signal back down to slow it down. Okay, the signal never gets trapped here and doesn't make it back to the heart. So the brain keeps trying to send that signal, and it can actually panic and start to throw a lot of signals out, which makes the heart starts to beat faster and faster. And the brain panics, and we can call that anxiety or panic attacks. And I've seen this a lot in patients as well. And getting the pressure off those nerves, restoring that normal communication to the brain and the heart. I've seen patients on anxiety medication just stop having anxiety, stop having panic attacks. And then we talk to their medical doctor about getting off these medications. It's pretty amazing when you find out that it's really a neurological problem and not just a chemical problem, you know. So we're looking at the same problems we see in the lungs as well, because the brain controls the lungs. And I see a lot of kids in my office, and they come in with pain in their middle back, and they're on these asthma medications. And we see they have all these misalignments in their mid-back that actually the vertebra up the top that control the lungs. And so we start adjusting, getting pressure off of those nerves, and then the lungs start working properly, and they don't have asthma attacks. And so we have worked with the medical doctors to help them wean off of this medication. So if the brain's not controlling the lungs the brain's like the manager. And you have employees that are doing their job, but if they don't have a manager telling them what to do, sometimes they get slack and then stop working. Okay? So the brain has to control what's going on at all times, and it's the master system. So if there's pressure on those vertebrae, and those vertebrae are putting pressure on the nerves, they go to the lungs, there's no way the lungs are going to work properly. okay, which means you can't heal, you can't have normal lung function. A lot of times you might not have normal exchange, or the lungs might not open or move properly, and then it opens itself up for disease processes that happen too. So that's kind of the basis of chiropractic care. We're talking about the vertebra putting pressure on nerves, but then also those same vertebra control the lungs that help move. And so when we see people with scoliosis or thoracic problems or mid-back problems, then those nerves are affected that control the different organs. It's the heart and the lungs, and even lower down the nerves that control digestion and how things work. I've had patients had severe constipation. They come in, and then they told me the next day they spent a day in the bathroom after we got this pressure off of those nerves. So if your nervous system is working as best as it can, that gives your whole body a best chance of healing it and doing a lot better. Okay, so I think it's just an integral part of what you need to heal as well. So you need your nervous system working at the best it can possibly be. And you're talking about a nervous system, and you want to heal totally your nervous system, and every system in your body needs to work properly. And that's what we teach in our office. We do seminars on how to get everything working properly through nutrition and through exercise and through spinal health and nervous system health. So I think that's just extremely important. All right, what we got next there, Dan? What's the next slide? Yeah, went too far, but that's all right. We can go right here.
That's right.
Huh? Is it? Oh, okay. So we talked about the thoracic vertebra, which is the vertebra that controls your rib cage, but your cervical vertebra are super important as well, because the nerves from your neck, the top of the neck, those nerves go up in your head and your face and control your sinuses. So it says the top vertebra, the atlas and the axis, pressure on those nerves can affect your sinuses. You can have sinus problems, which can obviously lead to postnasal drip or problems, which lead into more congestion in the lungs, which is the last thing you need when you have breathing problems. And then the next three down, cervicals 3, 4, and 5. We learned in school, 3, 4, and 5 keeps the diaphragm alive. Okay, so 3, 4, and 5 control the vagus nerve and the phrenic nerves, and they go down into the lungs. You see the diagram on the right, how those nerves go right to the diaphragm. Okay, so if someone has a severe neck injury or neck fractures from some kind of accident or collision or something like that, if there's damage to those vertebrae 3, 4, and 5, then EMS needs to know that immediately, and they need to employ breathing apparatus, because you might not be able to breathe if those vertebrae are damaged or severe pressure on those nerves in there. Okay, so not only does your mid-back have to work properly, but your neck has to work properly, because you need your diaphragm working as best as it can. So if even there's some pressure on a couple of those vertebrae, and maybe only half your diaphragm is working at 100%, guess what? Then you're not going to get a full breath of air. You're not going to be able to get as much capacity out of your lungs as you can there. Okay, so we always focus on the neck, and we focus on the mid-back to get everything working properly. I already told you about heart function, how the brain controls the heart and can lead anxiety and panic attacks. So you see C1, there's a lot of research showing that the very first vertebra controls how the heart works, but also C7 and T1. It doesn't show the T1, but the very bottom of the cervical, and it kind of interacts with the first thoracic, which is C7 and T1. That's how the brain controls the heart. Okay, and even we go as far as in more neurology, the brain is split into two hemispheres, and one side controls the rhythm of the heart, which is the left side of your brain controls the rhythm, and the right side of your brain controls the rate of your heart. So we look at patients that might have a problem where their heart's beating too fast, and I try to focus on vertebra on the left side to help the right side of the brain move up a little bit further into more advanced neurology. But then we have people that have their hearts just keep skipping a beat or in the improper rhythm, and then I'm trying to affect sensory modalities or problems on the right side of the brain, the right side of the body, to affect the left side of the brain there. So a little bit more advanced stuff there, but you can see how advanced the neurology and how all this can affect either how your heart's functioning or how your lungs are functioning. It all kind of works together. But I don't think you can address just the thoracics or just the cervical. So if someone comes in my office and they say, oh, I got this pain burning under my shoulder blade, and I'm thinking immediately that's probably a rib problem. I'm not just going to look at just that rib or that pain that they're pointing out to me, because the ribs attached to the thoracics, and they can affect how the nerves are affecting the lungs, and also that if that's misaligned, it's connected to the neck and the neck vertebra, and then if they're not working properly, that can lead to problems later on if they don't already, because we don't focus on symptoms because the nervous system controls everything. So if you have pain in one spot, you might have a problem in another spot that controls the function of an organ. So I try to adjust full spine. I check, make sure that every vertebra in your spine is working properly, because if we don't, we'll solve one problem and then not another. We threw the shoulder in here, and obviously the shoulder is a big part of it. And you see, if you're sitting crunched up and your shoulders are forward, it's compressing the top of your rib cage. And the most important bone here, believe it or not, is your collarbone. The very top bone says the clavicle right there. And the clavicle actually pushes your shoulder back and keeps it away from your body. Without that clavicle or your collarbone, then your shoulder's kind of rolled in. So that clavicle rotates kind of like a dowel. Think it kind of rotating on its axis. It goes back and forth when you move your shoulder. I would venture to say 70 or 80% of shoulder problems and shoulder pain usually is because that clavicle is not rotating properly. It can become misaligned and cause problems. We do something simple just to get that clavicle rotating properly, and that clears up a lot of shoulder problems in there. Okay, so if you're accessory breather, where you're mostly breathing with the very top of your rib cage, a lot of times you're pulling your shoulders in and you're compressing your lungs, and that clavicle gets jammed, and then you lead to not only breathing problems, rib problems, vertebra problems, and now you have shoulder problems. So
that happened to me a lot. I used to get anxiety attacks because of that very same issue. Yeah.
Yeah, Chrissy was a very accessory muscle breather. You can see those muscles in her neck above the clavicle just kind of pulling, and they're pulling up, and you see her neck kind of strain, and trying to breathe with just the muscles on the top is not a good, very efficient way of breathing. You're using maybe 10 or 15% of your lung capacity instead of the breathing technique that we talked about just now. All right, let's go to the next slide. There we go. All right. So I talked about moving vertebra and moving ribs and getting off of these nerves. And we talk about soft tissue correction, because I can get joints moving in the first visit. A lot of times we'll get things moving, but the muscles and the ligaments that surround all these bones and joints and other structures, they have healed back in the wrong position in there. So if you had an accident, you've fallen, or you've been in a car accident, usually you're damaging ligaments, which connect bone to bone, or you damage tendons, which connect bone to muscle. You get damage in those, you get scar tissue, things are misaligned, and then it takes 6 to 12 weeks for those to heal. And if you don't get any kind of body work or correction at that time, chances are they're going to heal wrong. Okay, so if we can move a bone, a chiropractor can get a joint back in place or adjust a vertebra. But the problem is the muscles and the ligaments and the tendons have healed in the wrong position. And we can only move and affect those little by little. Okay, so we do a lot of muscle work and soft tissue work in our office there. What's the next slide? And okay, and so these are the main muscles that we're working on, and this is the body from the back, and you can see a lot of muscles that attach just to the spine. If we just work the vertebra and try to keep them moving, it'll take a while to get those vertebrae move and things to start to address and heal properly there. So we'll do soft tissue and several different types of techniques. And so if you find a chiropractor near you, you can ask them about what kind of muscle techniques they use. There's a myofascial release, or MFR. There's active release technique, and that's what we use on the triathletes. We do something where they move their arm while we're actually working a muscle in the arm or the shoulder. And so the patient has to move with them. And what we're trying to do is break up that scar tissue. And scar tissue, or like adhesions, are just even you get small little tears in the muscles, the ligaments, and tendons, and then they heal wrong. They don't heal normally straight. They heal kind of in a haphazard manner, and they heal like as a patch, which means it's weaker than regular tissue. So we can go in there by hand or by using tools and actually break up that scar tissue. And then we do exercise to get those ligaments and muscle tendons to heal back properly. A good massage therapist who knows medical type massage can do that as well. There's some Reiki, and there's a couple different techniques, a deeper tissue shiatsu, kind of things like that. That's the kind of massage you want. So if you're going to go for a massage, sure, it's nice to get a nice fluffy massage and feel good, but I like to get a massage therapist that knows how to break up things and actually addresses some problems, because these muscles can twist and turn and then kind of heal wrong onto each other. So massage therapist or a chiropractor knows how to break these up and get them to heal back the right way, so all these muscles can move and slide on each other there. So if you just go to someone who just wants to rack and crack you and just kind of get you moving, you go in and out in 2 minutes and without addressing the muscles, then I think you're missing a big part of trying to heal and work properly there. So again, if you're more of a shallow breather and you're not moving as much, these muscles can just shorten down just by doing that. And then through the adjustments and muscle work, you have to open up the rib cage. And you can work on these muscles and the muscles in between the ribs, the intercostal muscles, to try to get your ribs to be able to expand and move as much as possible. Now, this is some of the muscles in here, but we're not going to really go through them. But there's a lot of different muscles that can cause problems and all around the rib cage. I think rhomboids are really big. If you get anyone here's got the burning by their shoulder blade, that's a rib rotating, the rib heads out, and those rhomboids are on fire. They're trying to fight that rib from pushing into them there. All right, Danny, what's the next slide? Okay, and then let's go into some of the deeper muscles. We already talked about the intercostal muscles, how the intercostals help you breathe in and breathe out. So the external help you breathe out by expanding the rib cage. The internal ones, if you're trying to forcefully breathe out, then those are the internal ones. You're trying to blow out a candle that won't go out or something like that, using your obliques. Okay, I went through all this stuff already. Okay, next slide. All right. So we kind of went through a lot of this, how the spine affects the nervous system, and chiropractic deals with all that. And you can see how that kind of all works together. Let's go to the next one too. This is a very simplistic version of the spine, and you can see where different vertebrae and different nerves come off of the brain and control different parts in there. Again, see 3, 4, 5, keep the diaphragm alive, so keep that in mind, because diaphragm is your main breathing muscle. You need to keep that moving and operating properly, so your neck needs to be working properly. And you can see the intercostals are controlled by almost every thoracic nerve and every thoracic vertebra. So a problem at any joint or joint level that affects a rib can cause problems in your breathing, but especially the very top muscles there. And that's the T 1 through 5 there. Okay. Any lumbar problems or low back problems, everybody knows that those go down into your lower back as well. But still, you have low back problems, all the vertebrae are connected, and that can lead to problems in the top of your vertebrae as well. Okay. Last slide is related problems. And, you know, like I said, the nervous system controls everything. The reason I got into chiropractic is because I had terrible headaches growing up. You know, I went to all different doctors. They gave me medication. I went to scan my brain to see if neurologists could find anything wrong with me. I had a dentist said problems with my jaw, and I had ENT said I had problems in my nose, and I had surgery for my nose and all that. But the only thing that ever stopped my headaches was chiropractic, because it was actually a problem, probably even might have been just from the birth process, because the doctor might pull your head of the child one way and pull it another way, get the shoulder out. And by doing that, by pulling on the head of a little baby just being born, can throw those very top vertebrae out. And we see that a lot in the office. In fact, we check all newborns for free. We did free treatment for newborns up to their first year of life, because those top vertebrae out, they can cause not only headaches. A baby can't tell you have headaches, so what do? They're going to cry. We have colicky kids with it's very different technique to treat babies than adults or geriatrics. So it's very easy for babies to be treated, but that's the first vertebra, and the first adjustment usually can cause that, but also can cause problems with breathing in babies too. And there's something called the KISS syndrome, where the pressure on the nerve, the very first vertebra, can actually stop the conscious control of breathing, the subconscious control of breathing. So the baby can breathe consciously when it goes to sleep. Pressure on that spinal cord in that area, in the very top vertebra, can actually cause the baby just to stop breathing, which is called sudden infant death syndrome, SIDS. And I think they did, I forget how many autopsies they did on SIDS cases, and every single one of them had a problem at the very top of the vertebra there. So the very top vertebra called the atlas. We see a lot of patients that have dizziness, and that's also the very first vertebra of the atlas. I'd say at least 80% of cases of dizziness that I've seen are caused by the very first vertebra and how the skull articulates with it. I've seen patients take all kinds of medication for dizziness. They did the Epley technique if they thought it was inner ear, which didn't do a lot for them. Some people it helps if they have actual inner ear problems, maybe 10% of dizziness, but 80-90% of dizziness is the top of the neck. And I can prove that because patients come in, they have dizziness. We adjust that vertebra, they don't have dizziness. I mean, there's proof in the pudding for that, I think. How the jaw is affected, that can affect headaches, sinus problems. We talked about anxiety, mid-back sinus problems. But also, if you're get ill a lot, you're sick a lot, besides nutrition, having your nervous system function properly helps you be well properly as well, because the nervous system controls everything in your body, especially your immune system. Okay, there's a link through the hippocampus and different areas of the brain where they prove neurology can affect actually how your immune system functions in there. I read a couple of studies and it said if you get adjusted when you have a cold, that can increase your immune response by 60% and actually lasts for up to 3 days. So the first thing I do when I'm sick, I get adjusted and I feel better pretty quickly. And plus I deal with different nutrition and we can get better pretty quick there. Okay, so there's a little bit of information there. How to find a chiropractor or a doctor that can help you with some of these things if you have anything that I talked about. Number one, make sure they're not just going to jump to the conclusion it's just one thing. Number two, they should do a thorough exam. We do about a 100-point exam on every patient that we do, and a lot of times we're going to take an x-ray on that patient because there's things I've seen on x-ray that I didn't even notice just from doing all those tests from an exam in there. I don't usually adjust somebody on the first day because I want to review their exam findings, I want to review their x-rays, I want to make sure I'm going to choose the best course of treatment in there. If you go to a chiropractor and you lay down and they just want to adjust you right away without doing all that stuff, that wouldn't be the chiropractor I'd want to go to. Okay, so there's all different doctors out there, and there's good and bad doctors in any profession. And so I believe in being thorough, and I like a doctor who wants to be thorough and exactly know what's going on before they even start treating me in there. Okay, if they take an x-ray and you think you might have sarcoidosis, you'll see that on the x-ray probably. It's pretty apparent, and so, for me now I can recognize it pretty quickly, but if they don't, then there's a lot of radiologists that can help them find out. Okay. And ask questions. One of the best ways to find a good chiropractor is just to ask other people and ask them, who do you think is a chiropractor, and you'll get feedback. All right. Sorry I went a little bit long there, but that's me. I talk a lot.
No, that's great. Yeah, so we have, do we have some time for questions? Take 10 minutes for questions?
Yeah, sure.
Okay, so everybody here, feel free. The best way to do it is just to type in the chat box any question you might have for Dr. Daniel Falk. And I had a question. You mentioned a few times, we talk a lot about nutrition, and I know Christy and I really covered that, and I have, gosh, probably 80% of my book and Total Wellness series is dedicated to nutrition, and breathing is a big deal too. We go through that. But what do you have, what kind of diet do you follow or do you recommend? Do you have any preference?
Yeah, in my office, we play movies and videos that have to do with health and nutrition, especially is the most common that we have. I think obviously a plant-based diet is one of the best diets you can have. And a lot of diseases can be related back to just eating meat and meat products there. Now, we have a hard time with that because we like meat. We eat cheese now. So, and it's hard to say, okay, just stop eating meat. Now, if I was dealing with a cancer or some kind of severe disease and illness, the first thing I would do is stop eating meat. Okay, and I also wouldn't cook vegetables a lot. Maybe you can steam them or eat them raw. You want to get all nutrition out of it as you can there. Okay, so
Right.
We're not that disciplined and not dealing with as severe illnesses. So we're trying to do 2 or 3 days of the week with no meat at all. Okay,
And less sugar.
yeah, we started with meatless Monday. Oh yeah, sugar is definitely the worst. Sugar is highly addictive. Sugar is 10 times more addictive than cocaine. And this whole country is addicted to sugar in the United States. Especially refined sugar. You can get sweeteners in other ways. If sugar in the raw is a close step down, but then, you can get honey or agave or other things like that if you want to put wheat in that way there too. I did different vitamins, but I think, and I did more research, I think the most important thing that you can do is increase your probiotic level. Because, that's what I've been doing. I was having problems getting colds a lot. I have so many patients that I see that get sick, and they get me sick because I'm physically dealing with them. And so now I'm trying to bring my probiotic level out. So if you've ever been sick, you'll have antibiotics. And then I'll get your question in a minute, Ms. Sherry. But if you have antibiotics, it kills a lot of the natural flora in your body. Now, there's something like over 1 trillion cells that make up you, that are the cells that are you. There are 10 times more cells and bacteria in your body that aren't you. 10 times more cells that are your natural bacteria that's helping you stay well. That makes up 70% of your immune system. Okay, so if you're sick and you tend to get sick a lot, I think the best thing you could do is get a probiotic. And I'm talking something with 25, 30, 40 billion cells per capsule with several different types of strains of probiotics. The most important strain is Lactobacillus plantarum. Which probiotic do I recommend? There's a lot out there. Like I said, ours has, there's a Now brand, I think that's what we're using, and it's 25 billion cells per capsule. It's got 10 different strains, but make sure it has Lactobacillus plantarum because think of it plants in your body and it helps grow. So you always want to eat enough nutrients and enough vegetables so it has something to grow on. Those are prebiotics and some fruits. And then it's a good probiotic. And you always want to take your probiotics at night. And if you think you're really deficient and your immune system, you keep getting sick and sick, then you want more of a natural probiotic. You can eat something. And I'm not talking about yogurt because yogurt's kind of a flyby, only millions of cells. You want billions. But if you want the most powerful probiotic there is, I think it's kimchi. Kimchi is a Korean fermented cat. If you can handle garlic and spices and powerful smell that the dog won't even eat, and I do about a quarter cup of kimchi a couple times a week just to stay well.
Nice.
All right.
Good to know. I didn't realize kimchi was so full of probiotic.
It can be 1 trillion cells in one serving kimchi.
Sauerkraut's good.
Sauerkraut's the mild version of kimchi. You can't handle all the intense flavor.
Yeah,
I said breathe in through your mouth, through your nose. I think breathing in through your nose first and then out through your mouth is the way to go because you're breathing in through your nose. Just to go back to neurology, how the nervous system works, every nerve in your body synapses or connects to another nerve before it hits your brain, and then it makes another nerve, okay? So it's kind of like a little bypass, and one thing is called the thalamus, which is the kind of the traffic cop of all the nerves in there. So all the nerves go up to this thalamus, and then it controls where the rest of the nerve information goes. Every nerve in your body except the nerves in your nose. The nerves in your nose don't have to synapse or connect anywhere else. They go directly to your brain. So when you're breathing in through your nose, you're actually getting oxygen directly to your brain, and you're feeding your brain with oxygen and also nutrients in there. So you breathe in through your nose those 5 seconds, hold your breath, and breathe out through your mouth for 8 seconds. Hope that answers Sherry's question. Question up here, Lynn says, what do you recommend for the frequency of chiropractic care? It depends on the person and depends on what your problem is, and I'd usually rate that on what your symptoms are, what your exam shows, what your x-rays show. But a lot of times, if someone has a problem, they haven't been treated, 3 times a week is usually what we start. We've had some patients start more frequent than that. We've had patients that aren't as bad. They start 1 or 2 times a week there. So it kind of depends on the person. But a severe problem generally starts at 3 times a week for a month or 2, and then backing off so the body can heal and hold those adjustments and stay in place there. All right. And that's all the questions I see. Anybody have any other questions? I answer them, but.
Is the main reason why you treat so frequently at the beginning just because of the muscles and joints that want to pull those bones back out of place?
Exactly right. Each adjustment, the first adjustment may hold a day or 2, and then the muscles and ligaments all pull them back out of place there. But each, look at the probiotics we have. Each adjustment kind of builds on the one from before it, as I see. So every time I do an adjustment, I'm hoping it's going to last longer and longer. And then once I see the adjustment start to hold, then we can start to back off. So we'll do a re-exam at least every 12 visits, and then we can see the adjustments hold, and then we can start backing off to twice a week or once a week or sometimes every other week or something like that.
Okay. And when you say you do a 100-point check, I mean, we've probably all been to several doctors who just barely look at us and start writing a prescription or something like that. When you say you do a 100-point check, what is that? I mean, head to toe, lots of questions. What does that entail?
Now I might do, my staff goes through and goes over their history and all their problems, and I go through it briefly that way within a couple minutes. And then my 100-point check is palpation. I'm feeling different points in the neck and the mid back. I'm feeling all the different muscles that can be in spasm or cause problems at different levels. I'm checking the range of motion of the neck and of the lower back, and also checking orthopedic tests. We probably do 6 or 8 different orthopedic tests for the neck, and maybe 10 or 12 for the lower back. And each orthopedic test tells me and kind of guides me to a different kind of problem in the body as well. I also do extremities, so I'm checking range of motion orthopedic tests in the shoulders and elbows and in the knees and all that kind of stuff there as well. So all that kind of put together, it's at least 100 different tests that we do. And we add those up, the positive of those, and I put it on a graph. And then when we do another exam in about 12 visits, I'll go through all those same tests again, and then a lot of those tests have gotten better. And then we show how much they get better, and I can graph it and show the person how well they're doing at this stage of their treatment.
Perfect. So you kind of create a map, a base, and you can see if it's working or not. So in South Carolina, you have a clinic there. If anybody's in South Carolina, you need to go see Dr. Daniel Falk. Where are you at in South Carolina? We're
just outside Myrtle Beach. It's a town called Conway. It's a little town, about 20,000, and we're just the next town over from Myrtle Beach. So yeah, if you're in the area, stop by and say hi. Samuel said, "Can you please?" Oh, you have current. Wait, Samuel, again. Can you spell out the recommended probiotics now? And now brand I like NOW, probiotic 10, -10, and 25 billion cells there.
And the strains are, there's a lot of letters in those strains, and it's hard to spell them out.
Yeah, just remember the word plantarum. You want to see the word plantarum because it's planting in your gut. That's how probiotics are going to stay. Now probiotic 10, that's right. Yep.
And that's a refrigerated probiotic, correct? Because I think we take the same one. Christy and I figured that out on the last webinar. I was like, oh yeah, that's the one we take. You put it in the fridge. Yeah.
These are a lot of cells. Once you open the bottle, you got to put it in the refrigerator.
Yeah. Okay. Yeah.
Same thing with kimchi. If you don't put that in the refrigerator, it'll almost explode. So,
your whole house will reek within minutes.
Let's say you have current x-rays, it'd be helpful to bring them to a first visit. Yeah, and a lot of doctors want to take their own x-rays. You want your x-rays to be standing, I say weight bearing if you're in your neck or your back, because that's how it functions. If you have x-rays where you're laying down, it doesn't really show the true form of how your body works when you're functioning. But I'll accept x-rays if they're at least within 6 months, and then I'll have to take my own x-rays. But and usually if there's a lot of arthritis or some severe curves, then we'll take re-x-rays probably 6 months later.
Mm-hmm.
Okay.
Do you have any special tools or anything that you use in your clinic that I've heard of like laser therapy and different things like that. I don't know if do you use anything?
I don't use really special tools. One thing that we have is called decompression therapy. And decompression creates a negative pressure. It's like a computerized traction for the neck and the back. If you have a herniated disc or bulging disc, you'll see in any problem in the spine, but a herniated disc or protruded disc or ruptured disc, creating a negative pressure and pulling that disc back in, as we've seen discs heal. They don't want to give a percentage, but in my office, 70–80% of the time I've seen a disc heal without the need for surgery. I think the only time you really need surgery is if you have a disc that ruptures and the piece breaks off. It's called a sequester disc. Or if you have a fracture. I think the AMA came out 2 years ago saying the only reason for lumbar fusion is for a fracture in the lumbar. Another question. Roxanne said that has cardiac sarcoidosis. How does chiropractic help her with her illness? Again, you're freeing up the nerves. You want to be able to help the body heal as best as possible and provide as much information so the brain can control that. So I think that would help just by having the brain control that area. If you have severe pressure on nerves and the brain can't control the heart, then there's nothing stopping the heart from going out of control and having some problems in there. And you're going to see in the next month and the following month a lot of nutrition for sarcoidosis there. But you got to have your nervous system functioning for everything to work properly. So I think different doctors working together, if the chiropractor is doing nothing but freeing up your nervous system, helping work, that's going to be very powerful for any illness, and especially cardiac or lung problems.
Yeah, absolutely. And this is all a holistic approach. So it's, you know, it's treating the body as a whole, whether it be nutrition, chiropractic, massage. I know people who've had really a lot of success with acupuncture. There's just so many different ways and things to try, and where I know everybody here is really into improving their health naturally. And a lot of people, I'm sure you treat a lot of people who see Western medicine physicians, and you're able to help them even though they're taking lots of different medications and trying all that route as well.
Oh yeah, absolutely. I mean, a lot of our patients have medications, and a lot of times our goal is to help them get off of the medications that they're on. And you got to be able to have a medical doctor that's willing to take you off. I don't know what's changed besides all the money in medicine, but if you remember 20 years ago, you had a problem and the doctor would give you medication until your problem's better, then take you off. They don't do that anymore. They'll put you on medication and they don't even know how to take you off a lot of times. They'll just keep you on it. It's just easier that way. And so they're just putting people on medication and maybe adjusting the dosage. But to find a doctor that's willing to recognize when you get well and taking you off medication is the kind of medical doctor that you're looking for. Because every medication that you take is toxic to your body. You know, it helps one area, or it might affect one area, but the rest of your body has to deal with the toxicity of it, especially your liver and your kidneys and all that there. So you got to remember that every medication you take compounds, and so the more that you're on, the more your body is under this stress and dealing with medication. So then you're needing different nutrition to be able to handle that kind of stress. Which foods do you highly recommend to avoid, says Christina. Sugar is number one, I think, right?
Yeah, and gluten. Gluten is a very inflammatory food. So the less inflammatory food you consume, the better. Right,
yeah. So yeah, try and avoid, gluten can be inflammatory. Sugar definitely is inflammatory. And unfortunately, alcohol is inflammatory. Now, we'll drink alcohol, but definitely wine has some antioxidant effects there, but everything in moderation in there. So, and if you can look up different anti-inflammatory diets, it's a better way to go, because we're always dealing with so much inflammation in our bodies. Yeah. Yep. We about wrapped it up. We're about.
I think you're awesome. I thank you so much for taking your time. I know you had a crazy hectic day and treating. How many patients did you treat today? I'm curious.
I treated 54 patients today, and it's our short.
Oh my goodness. And here you are tonight, spending an hour of your time with all of us. Thank you so much, Dr. Falk. We really appreciate it. So grateful. So Christy, I just want, in closing, for you to share one of the guests we're going to have on our next webinar. It won't be till August. We have a webinar in July, and we have a special guest coming to that webinar, but I'm really excited about this naturopath that Christy's going to talk about here for just a second, that we'll have on our August webinar.
Yeah, she is the naturopath that I met in Seattle a couple years ago. She is the one that changed my life, saved my life time and time again. And I am so excited that she's going to join us in August.
We met her at a chiropractic convention.
Yeah, she was at a chiropractic convention when we met her. She is wonderful. She does Chinese herbals. She does a lot, and I honestly can't say enough about her. Her name is Dr. Lorena Shinsato.
But next
Lorena
month is
Shinsato. Okay.
Yes.
Next month is Way.
Yeah, next month we have Rachel Urbis from Way Laboratories, another Chinese herbal company.
Oh, excellent. So we'll be talking about some anti-inflammatory herbs and breathing. I'm sure herbs that improve breathing and different things like that for healing the body. So guys, I want to thank you so much. Again, just really, Dr. Falk, thank you for coming and giving us your knowledge and your wisdom and sharing lots of tidbits of information that will help people. The breathing technique, I just want to cover that just real quick, is extremely effective in relieving anxiety. And I know a lot of people with sarcoidosis, because you start having a hard time breathing, it then causes more anxiety because you feel like, oh my gosh, I can't get a full breath. And so this breathing technique has helped a ton of people just just to relieve the anxiety and help your body get the oxygen that it needs and not have those panic attacks and work yourself into that frenzy. So
right, and have your lungs be able to work as best as they can by making sure that all the vertebrae and the ribs can move enough so you can expand your lungs as much as you can. Good posture and the breathing technique, and all those joints moving properly, the nerves free. That helps the most.
excellent. So everybody's going to go and make a phone call tomorrow and schedule a chiropractic appointment, I'm sure, and take all this information, improve you guys' lives. And thank you guys. Thank you, Christy and Dr. Falk, for being here. Thank you to everybody else for being here. The recording of this will be available by Friday at the latest, and we'll make sure by email that everybody gets the copy, the link to listen to it over and over again, and share it with your friends if you feel like it's going to be helpful for them. Again, just thank you so much. We'll be back here on July 26th with the herbologist from Way, and then again in August with the naturopath that has helped Christy heal so much and help many other people. I just want to wish everybody a wonderful evening, and thank you all for being here. You guys have a great